This segment of Delmarva Life is brought to you by Peninsula Regional Medical Center.
Now that we're diving right into October, it's safe to say flu season is here and all the crud that comes with it.
The fever, the fatigue, the muscle aches, the yuck. The Centers for Disease Control and Prevention reports on average 5 to 20% of the population comes down with the flu every year. More than 200,000 people are hospitalized from flu complications, and 3,000 to 49,000 people die each year because of the flu. So, what can we expect this flu season? The CDC says it's unpredictable. The timing, the severity, the length of the season, different every year.
So hearing all those numbers, it may surprise you to hear the CDC reports only 46% of people got a flu shot last year.
Now, there is a lot of debate surrounding flu shots for adults, yeah, but especially for children. But now for the first time, the CDC is recommending certain children get the flu missed instead of the shot.
This is the first year that the CDC has made any recommendation for one flu shot instead of another if available. So this year they've recommended that at ages 2 to 8, if it's available, you get the nasal flu mist instead of the flu shot.
And 1, 2, 3, do it.
The nasal mist is made with a living virus that's been weakened, unlike the flu shot that is made with a killed virus. In years past, the CDC did not recommend one flu vaccine over the other. However, after studying the effects of the nasal spray in ages 2 through 8, results showed the mist prevented 50% more flu cases than the flu shot. Officials say this is because the nasal spray shows a better response in the upper respiratory tract in these age groups. However, there are some children who cannot take the spray and should get the shot.
Children who are ages 2 through 4 who have asthma or wheezing in the past 12 months should not have the flu mist. Immunocompromised patients should not have the flu mist. Kids on aspirin should not have the flu mist.
Doctors suggest people of all ages should get some type of flu vaccination to prevent the spread of what can be a deadly virus.
Even though the flu mist is recommended ages 2 through 8 if available, if it's not available where you're at, go ahead and get the flu shot.
Of course, if you have any questions regarding your child, it's best to speak with their doctor.
But what about you? Have you had your flu shot yet? Registered nurse Mihalik from Peninsula Regional Medical Center is here to show you just how easy it is. Thanks for joining us this afternoon. First, I want to clear up any confusion there may be, because a lot of people got the flu shot last year but still came down with the flu. How is that?
Some viruses, strains are not in that vaccine, so you may have gotten a vaccine strain that's not in there. However, a lot of people think they have the flu and it's really a cold or some other virus. It's really not the flu, and you have to actually be tested to do that. However, one of the things is if you do get the flu shot, even if you get a different strain of the flu, it's not as bad as if you did not get it at all.
Oh, okay.
So the vaccine in this year's shot is based on last year's strain, is that right?
That is correct.
How does that work?
What the CDC does is they look at what last year's vaccine, what the strains were that came in for the flu,
right,
and then they make the vaccine based on that. And this year is actually the same strain that we had last year.
And what will it protect you from?
There's 2 types A, and then there's type B vaccine that is also our vaccine strains that are in there. H1N1 is what everybody wants to know about, and yes, it's in there.
It's in there.
It's in there.
All right.
What about the enterovirus that we're hearing so much about? Does this work for that too?
No, this is just for the flu, and there's no vaccine for the enterovirus that's out there right now.
All right, so people are starting to get their flu shots now. How long will that shot last, that vaccine?
It should last through this flu season.
Really?
So next year you should get another flu vaccine.
Okay, so let me ask you this. Why is the mist recommended over the shot for kids?
They've done some studies, and it's worked very well. It's very efficacy for the kids.
Right.
It actually is working very well for them. Now, one of the things is that you cannot get that if you're over 49, and you have to be, for the kids that are between the ages of 2 and 8, it's working very, very well. Now, children that have asthma, if they've had any type of wheezing in the last 12 months,
right,
they do not recommend that they get it. So chronic diseases, you need to check with your physician.
Okay, well, what if you're an adult? What if you don't like needles? Can you get the flu mist?
You can get the flu mist up to age 49. They have done studies for that. And those that are not chronic diseases, no diabetes, no chronic respiratory diseases, no cardiac diseases, can get it. Now, you have to check with your doctor to see if they have it.
Right. So you recommend everybody get the flu shot,
Yes, everybody over 6 months of age.
but there are some that need it more than others?
Yes, children, pregnant women, people that are immunocompromised, the elderly, everybody really needs it, but those people really need to look at getting it.
Now, women who are pregnant, can they get the flu worse when they're pregnant?
When you're pregnant, things are changed with your immune system, with your lungs, with your heart, with all the chronic organs. So you are a little more sensitive to getting the flu. So you could get it, but you can get the same things as someone who's not pregnant. You know, you can end up getting the flu and get the pneumonias. You can get some of the other things that go along with that. And it's bad for the baby, could become premature. So you don't really want that to happen.
So there's been talk about the flu shot being related to autism and thimerosal being related to the flu shot to autism. Can we ask for a thimerosal free shot?
There are some thimerosal free shots, but you need to check with your physician for that. Actually, autism really has been shown not to be related to the thimerosal and to the vaccines. There's been multiple studies for that. You still can get thimerosal free. We try not to put anything in the body that you really don't have to.
Right.
But thimerosal is not in usually the prepackaged single-dose vaccine.
Okay.
If it's a multi-dose vaccine bottle, that vial usually does have some type of thimerosal preservative
Which means
in
they-
it.
they
would
fill
draw
the-
it up.
Yeah, okay.
They would draw the syringes up from the multi-dose vial.
In the past, I've heard about people with severe egg allergy, that they should not get the flu shot. Is that still the case?
If it's a severe egg allergy, yes. However, if you can eat cake and cookies that have it in there, you can eat a scrambled egg, then yes, you can take it.
But there's an alternate now.
There are a couple alternates out there that are not made from eggs.
Come on, tell me
one-
what that's made from.
Okay, worms. It's made
I
from
love that.
worms.
Worms. Okay. So you get the flu shot. Of course, you feel a little pinch. Are there any other things that might happen after you get the shot?
You can get a sore arm from it. It's what most people complain of. Sometimes people get a little slight fever, headache. If you're getting the actual flu mist, you can get a runny nose, a cold type symptoms, but you really don't get anything that's like a pneumonia or a lung infection from it.
Great.
Okay, so you're going to give Lisa her flu shot.
Yes, I am.
And you've got an event coming up. Tell us about that while you're shooting Lisa.
We on October the 18th, on October the 16th and 17th, Peninsula Regional has its annual drive-through flu clinic that's coming up,
Right.
and it's at the Arthur Purdue Stadium. It is from 10 a.m. to 6 p.m. It is a donation of $10, and we will be out there waiting for everyone to come.
Wonderful.
All right.
Okay, so what are you going to tell Lisa here as far as taking the shot?
Take a deep breath and relax.
See, I knew what she was going to say before.
Relax is the big thing, isn't it?
Yes. One of the things at the drive-through flu clinic, people do put their arms out the window, and we just actually ask for them to take their arm and put it back in the window.
Why?
Just relax, Lisa. Like Lisa just relaxed, and you could see her relax.
Right.
You can't relax your arm when it's up on the window. If you try putting your arm up
okay.
like this, you can feel it's really tight. It's not relaxed at all.
All right. That's not so bad. Actually,
was
that's
it.
not bad at all.
Do you want a Band-Aid?
Yes, of course. Especially if it's like
She's earned it. She
pink
wants her
one?
Band-Aid.
Oh,
Sorry,
pink one.
it's just a tan one. You're not even bleeding, but
So
you get a Band-Aid,
What
Lisa.
should she do now as far as using the arm? Should
Just move your arm around. If you can get it in the arm that's actually your dominant arm, it's better for you.
Oh, really? Okay.
So, and just keep moving it around.
That'll work out.
All right, that was easy. And if you would like to get your flu shot, here's the information. It's PRMC's Drive-Through Flu Clinic, Thursday, October 16th and Friday, October 17th, 10 a.m. to 6 p.m. both days?
Yes,
At the
both days.
stadium. And
Just-
you want a $10 donation if they can.
If you can, yes.
All right.
If not, we'll give you the shot anyway.
Thank you.
Thank you so
You're
much.
welcome. Thank you for having us.
And to read more about PRMC's Drive-Through Flu Clinic, go to WBOC.com and click on the picture at the top of the page. Well, the flu shot is just one way to try to avoid getting sick. Another prevention tool, taking your vitamins. Up next on Delmarva Life, we'll hear about an interesting alternative to popping those over-the-counter pills we see at drugstores.
But nothing is worse than that feeling of the first person in your family getting sick, and you just know it's about to make its rounds. Well, hey, guess what? Not so fast. Still ahead. We're going to hear how to protect yourself from those germs in the air this time of year. Delmarva Life. We'll be right back.